every Wednesday, 8 to 9 p.m. here on BFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
And good evening to you. This is Your Health Matters, and it does. Your health really matters. This is Dr. Gerald Thompson with your usual Wednesday night program. And I want to send out greetings to all of you. You know, I've been really touched. The number of people, Kamal, who are stopping me and say, you know what, I listen to you every Wednesday night. I don't miss it. And, you know, from what I understand, you know, a lot of these people are not necessarily listening on Facebook. And so they're turning on the radio or they are putting on their phones, you know, to, is it tune in? And so therefore, it's not registering electronically. But how do we get a picture of all those people who are turning on their radios? Do you know? Yeah? Can we scan that? I mean, I would love to get a much better idea of the listening public. And I've been, you know, surprised. People in New York have told me this directly. And I really am pleased and inspired by this. This year, I promised that we were going to have a lot more interviews and so, but I want to start off this year with a special subject that's dear to me. I'll come back in a moment and talk about it. But remember, we're interactive. 457-9997. Digicel 53297 or WhatsApp. WhatsApp has really become the go-to thing these days. You know, give us a call on WhatsApp. Text us a message on WhatsApp. We'll get it, we'll receive it, we'll answer it on any subject that you may want or on the subject of the day. That subject today, I want to talk to you about a special type of cancer. Matter of fact, you may say, Dr. Thompson, I want you to talk about something nice. I don't want you to talk about anything depressing, but I got to talk about cancer. I want to talk about colon cancer, cancer of the large intestines and the rectum. Let me get this clear. Everyone should know in terms of how food travels in and out of your body. How food travels in and out of your body. There's your mouth. And you know, you chew your food. Then it goes down your throat into your food pipe. We call the esophagus. And that somewhere that could also have cancer. Then it goes into the stomach. Oh, and the stomach in some countries of the world, stomach cancer is big. But I'm not talking about stomach cancer today. The stomach is an area where you can have cancer. Then from the stomach, that really start to blend up the food. That's where your few foods start to get pureed and blended up in your stomach. And all kind of enzymes go inside there to help digest it. But then it goes into the small intestine. And in the small intestine, that's when other special juices are added to the food to really digest it, really break it up and extract out the protein and extract out the good fats and the bad fats and extract out the sugar, your small intestine. Then from your intestine, your small intestine, it goes into your large intestine. First of all, it passes the area where your appendix is, right? That is right down at the bottom of your belly, over on the right-hand side, down at the bottom, right? The small intestine goes into the large intestine, right near to where the appendix is. Then the food travels up back towards your chest, towards your liver. Then it goes across. Guess what? Yes. The food, the large intestine goes across underneath your chest, underneath your ribs, and then down. The left side inside your body, the left side inside your body, where the large intestine turns into the rectum. And then the rectum stores the stool for a short period of time before it is expelled through the anus into the toilet bowl, to the outside. The large intestine is a very interesting organ because that's where, after all the digestion that's taking place in the stomach and the small intestine, it's like, you know, a washing machine washes the washes the clothes, I should say, right? And I want you to consider your stomach and your small intestine washing your food, right? And getting out the stains and getting out this and, you know, really doing all those things. And then your large intestine, I want you to look at it as being the spin cycle, where the washing machine starts to spin fast and get out all the water. It gets out all the water. And so the stool now becomes much harder. You don't want it to become too hard. If it becomes too hard, you'll develop constipation. So it now moves from being a liquid that's inside your stomach and your intestine, where it was like a soup, and now it goes into your large intestine. And I want you to think of your large intestine as being the spin cycle that extracts the water and leaves the stool that is firm now and formed, ready to be expelled into your rectum and out of your anus. You know, that's how simple it is. But boy, a lot of things can take place in these parts of your body. And I want to say that colon cancer, cancer of your large intestine, is the third most common cancer worldwide, and can cause a lot of harm, including death. Colon cancer, because of where it is, that last part of your intestine, is often diagnosed only at an advanced stage, where sometimes treatment cannot be properly done. You hear what I'm saying to you? Now, I said it's the third most common. Some places in the world, lung cancer is the most common. But really, worldwide, breast cancer is the most common cause of cancer. I want to tell you today that in St. Vincent, prostate cancer in men is the most common cause of cancer, superseding that of breast cancer. There are more men with breast cancer than there have been women. There are more men with prostate cancer. Let me get this right. More men with prostate cancer than there have been women with breast cancer here in St. Vincent over the last few years. Before that, breast cancer was the most common. But colon cancer comes in third. Whether breast or prostate, colon cancer comes in third. And in the Caribbean, we don't have that high incident of lung cancer that you see in countries where the air is polluted. In Japan, in certain parts of China, in the United States, in certain parts of Europe, lung cancer is high. And of course, we have our smokers too, cigarette smokers. But boy, it's a double whammy. Being a cigarette smoker and living in a country that has high pollution rates in the air. I'm glad there are places like Rose Hall and Park Hill where the air is nice and clean. And in general in St. Vincent, we basically have good air. I know that Chateaubriand is labeled as Castle of Good Air. Chateau Bel Air, Castle of Good Air. That's what it's all about. Yeah, Chateaubriand, Castle of Good Air. But listen, now, colorectal, and I'm talking about the large intestine and what's the rectum. We call it colorectal. Cancer is the third most common cancer worldwide. And this accounts for about 10% of all cancer cases, right? And even though it is the third most common type of lung cancer, guess what? It's the second most common cause of death, of cancer death. And let me say that again. There are people with prostate cancer, but they don't all die. Some of it's picked up early. The people with breast cancer, and they don't all die, they're picked up early. But because colon cancer is often picked up late, too late, it often leads to death and is the second common cause of death, right? Now, it predominantly affects older individuals, naturally, with the majority of cases being people over the age of 50. I want to announce I'm over the age of 50. Kamal, you're not the age of 50 yet. So, now several lifestyle factors contribute to the development of colorectal cancer, such as, I'm going to say this, if you eat and you have a high intake of what they call processed meats, this is something that is now being proven. Processed meats, I'm talking about luncheon meat, packed sausages, Vienna sausages, all these kind of things and so forth come out. These processed meat that seem like meat, but they're all kind of different ingredients put together, colored, given a nice reddish, brownish color to make it look like meat. Really has a whole set of stuff in it. Processed meat is one of the big known causes, as well as, so that's a cause, as well as low intake of fruits and vegetables that have high fiber content in them. Fruits, if you live in a country or you live in a place where there are not a lot of fruits, or you don't have fruits available, or you don't have vegetables, can you imagine living in big cities where the only place you find vegetables and fruit is a supermarket? Yeah, you know what I mean? You live in a high complex. You don't have no breadfruit tree in your back, in your porch. You don't have a lime tree in your windowsill. You don't have a papaya tree in your living room. Or you can't go and have fruit trees in the parking lot of the apartment complex you live in New York City or Brooklyn. You can't have that. You know, there's no space. And first of all, they probably don't grow there. Yeah, there'll be some apples and some pears, but be so sure someone will eat them before you eat them. No doubt there are people with some small backyards and so can plant some things, but it's not enough. Winter comes by, nothing wrong. So you depend largely on the supermarkets and you have to pay for it. Could you imagine living in St. Vincent where you have a breadfruit tree in your backyard? You have an avocado pear tree. You have, other fruit trees and so forth that can give you. You have a mango tree. You have a horsey mango tree, a palo-over mango tree. And guess what? I bought a bag, a $10 bag of palo-over this morning. And I'll tell you something. I did share. I gave a palo-over to my brother and a palo-over to my sister. You may say, Doc, is that all? Yes, that's all. I basically ate the rest. I have a couple left. You understand? My palo-over precious. You know what I mean? You understand? Especially this early in the season. In a couple of weeks, palo will be knocking dog. And I'll be able to give away a lot more. But the early season stuff, oh boy, this is wonderful. Now, I'm going on that in terms of lifestyle, having a sedentary lifestyle, that is one in which you basically are sitting down, you're not exercising. And so, you're wondering, how does exercise relate to colon cancer? I'll come to that. And then obesity. How does obesity relate to cancer? Well, obesity could be related also to the type of food you eat. Obesity is something secondary. The food you eat will not only cause obesity, the food you eat could also be causing you colon cancer. It isn't necessarily that the obesity is causing the colon cancer. It's that the foods you eat, these processed meats and so forth, is not only causing obesity, it's causing you colon cancer. And we all know smoking and excessive alcohol consumption. That's it. Really simple. Long ago, our parents and our grandparents ate foods that helped their colon. Their bowels moved regularly, But today, all this stuff that we put into our mouth that is not natural, that is adulterated, processed food, ultra-processed food, is changing the inside of our body. I'm telling you this. Now, colorectal cancer is often diagnosed at an advanced stage. I've said that, right? When treatment options are now limited. If it's picked up early, it can reduce the risk by now using options that could get rid of and deal with the colon cancer. The incidence or impact of colorectal cancer can be significantly reduced by implementing screening. Primary strategies that you adopt for screening, as well as healthy lifestyles, avoiding the risk factors I've mentioned to you, and practicing early detection screening. Now, let's go back again. So colorectal cancer is a cancer that affects the large intestine or the rectum. We know, I've told you, it's one of the most common type of cancers in the world. And the risk of cancer can be reduced by eating healthy foods, staying away from unhealthy processed foods, not smoking, not drinking alcohol, and also regularly screening. This is the message that I have to get over to you today, right? Do you know there are 3.2 million new cases of colon cancer each year? 3.2 million cases. The population said was 100,000, 110,000 people. This is now an increase, right, over the last decade. And guess what? 1.6 million deaths take place each year from colon cancer. 1.6 million deaths. This is up 73%. In other words, the incidence of colon cancer is increasing. It's increased by more than 50%. And the death rate has increased by almost 75%. Let me correct, 73%. I'm saying almost 75%. It is increased. Incident tests of colon cancer can and has been decreasing in high-income countries. North America, Canada, Europe, Germany, England. Colon cancer has been decreasing, largely because those people have been put through effective screening measures to get them. But guess what? In the third world, in developing countries like ours, colon cancer is increased. That's where the increase is coming from. I said colon cancer has been increased by over 50%, and the death rate from colon cancer has been increased by almost 75%. Those have been occurring in places like St. Vincent and the Grenadines. Early stage cancers have a higher survival rate than the advanced stage of the cancer. So timely diagnosis, you've heard me say this 4 or 5 times now, they said, timely diagnosis, what is timely diagnosis? How can you tell me? Is it that you look in the mirror and, you know, you say, I'm diagnosed? No. There's some stuff that has to be done first. Now, I want to again go through some risk factors. Certain persons have a higher risk factor for colon cancer. And I've said about the age, you know, the risk is increased over the age of 50. Family history. If you have a family history of colon cancer, right? Or certain genetic conditions, there's certain conditions that lead to polyps and things like that, you know, then you are at an increased risk too. If your brother, your father, your mother had colon cancer, therefore you are at risk of having colon cancer too. So you should know if they had it. Then personal history, individuals who have had colorectal cancer before or certain type of polyps are at higher risk of having it again. In other words, when you get colon cancer once and you get treated, guess what the risk of having colon cancer again? You think it's low? It's high. You had colon cancer before and the doctor was treating you. Don't say, well, I'm going to relax now. I got rid of my colon cancer. You need to double check. You need to double check because guess what? It comes back. Not that the cancer comes back, but the reasons why you got the cancer could make a new colon cancer come back. And then, you know, let me tell you, you know, long ago when I was a little boy, I used to make something called a bobby from a balloon. Take a balloon and you blow a little bit of it, and then you could put it in your arm and anybody remember that? I used to love that. Well, those little bobbies are like a little nipple that a baby has. I want you to consider that little nipples, little bobbies develop inside your intestines. They call them polyps. Polyps. There are some people with conditions in which hundreds of polyps develop. And there's some people, only 1 or 2 polyps develop. But guess what? These polyps are at high risk of turning into cancer. These little bobbies, these little baby nipples inside your belly can turn into cancer. And guess what? If you go through screening, they could pick up a polyp and watch it. The next time we can watch, because if a polyp is there, it isn't that the polyp will turn into cancer in a matter of weeks or months. But if the doctor knows that a polyp is there, He could sometimes remove the polyp, or he could watch it and the next time. But if you leave and say, you know what, I ain't going back to that doctor, you know, he just feel me up too much. Or he makes me feel uncomfortable. He won't make me feel I got cancer, and I know I ain't got no cancer. I ain't going back to him. Matter of fact, I ain't going to no doctor. I go and drink some bush. I go and drink something that that my cousin tell me will help me. I ain't going back to no doctor. I can treat myself. Boy, if you have a polyp, make sure you check it out annually to see if it goes through any changes. If it goes through changes, go through changes slowly. So by the next time it's checked, we can take it. All right? So, polyps and then lifestyle factors. I keep repeating this unhealthy lifestyle, type of diets high in processed food. How many times have I said that, Kamal? Yeah? How many times have I said you have to avoid diets high in processed meats, processed luncheon meats, all them kind of things and so forth? Or diets that ain't got no fruits, ain't got no vegetables. Long ago, my auntie, when I lived in England, my auntie Pearl used to give me a big plate of food with a whole set of vegetables. If I go to a shop and I get some fish and chips, or I get some chicken and fries, is there any vegetables there? You may think the ketchup is the vegetable, right? That's not enough. The vegetable tomato, I got tomato in my fish and chicken and chips. No, you know. And then obesity, smoking. You know, I keep saying the same things all the time. You know. Now, what are the symptoms? I want you for colon cancer to look at these very important things, and I'm going to say them. A change in your bowel habits. Now, most of us, our bowel habits are fairly regular. From time to time, it changes up, right? But if you suddenly start to have more frequent diarrhea, or you start to feel constipated, or worse, if you start to oscillate between loose stools, constipation, loose stools, constipation, loose stools, constipation, that ain't nice. If you start seeing blood in your stool, either the blood is mixed in with your stool or the blood is on your stool, watch that. You understand? Especially if it is dark blood, or if the stool looks like tar. If it looks like tar, that pitch that they have on the road, that means the blood has been denatured. Or if you have abdominal cramps, pain, you know, and bloating, and that ain't going away, you know, it won't go away. Or you start having some weight loss, unexpected weight. You've been eating, you ain't doing no exercise, but you start losing weight. That's not nice, yeah? A sudden weight loss without trying. You ain't trying to lose weight, but you're losing weight. What's that? What's going on? Or feeling constantly tired and lacking energy. You know, just not having enough energy. Even though you have been resting, you ain't got the energy. And then if you have anemia, and they say you are iron deficient, the ways we could check, you know, we could check your blood and we see if it's iron deficient. So weakness, tiredness, you know, or a feeling that your bowels are not emptying. You haven't gone to, no. I'm not asking if you've gone to the bathroom because, and you feel your bowels ain't empty, because that would be suggestion that there's something wrong. But persons with colon cancer, especially rectal cancer, they feel as if their bowels are not emptying. You know why? Because the cancer is there inside the intestine, inside the rectum, taking up space and making you feel there's something still inside there. But it's not stool that's left back. It ain't number 2 that's left back. There's a cancer growing inside your intestine. When we come back, we're going to take the break now, and we're going to talk a little bit more about this, and we're going to get into some real detail of treatment.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. Now, I have been emphasizing today, and you know, diet. We live in a fast-moving world. And if you live in a country like New York or other places, boy, you got to live on fast food. You get up in the morning, bit of coffee, piece of bread, you know. Or if you're a construction worker and you go out, you buy a can of Vienna sausage and a Coca-Cola to eat. I understand. You know, on a construction site, it's tough. You throw away the can and you drink the Coke, cool you down. And so I understand. That never used to be how people ate before. And that's why these cancers are rising. Now, how do you screen? Well, that's tough because early stages of colon cancer can go unnoticed for years. Screening is important for early detection, and it is generally recommended that individuals at an average risk of colon cancer, individual at average risk, in other words, remember I told you, your brother, somebody family history, or if like, you know, you're a smoker, no, if you got the general gist, you should, it is generally recommended that individuals at average risk of colon cancer receive a screening test, every 10 years. Every year, you know, every 10 years. So if it's a family history, you start 40, you have 50, 60. This is because the most common colon cancers are slow growing. They're slow growing, right? And if we pick them up early, we would think, no, here in St. Vincent, we recommend going screening every 5 years. You understand? 5 years. That sounds more reasonable, right? And sometimes it's good to do a colonoscopy. Other persons, you can do a stool test. Take the stool and the various tests that could be done on the stool. We could check for blood, right? Or the stool could be sent to some special centers where they could pick up some special things in the stool. Does that sound strange? Your number 2, they could pick up and detect cancer in your stool. There's something called Cologuard for those who live in America. And so it's not introduced here, but you know, and so screening is important. But most of the time, and I gotta say, in Georgetown, there's an expert from Cuba who's able to do colonoscopy, right? He's doing a lot of them now. They never used to be done. And this is looking up your back passage. First of all, they tell you don't eat things overnight, right? We give you some things to clear you out a little bit so your bowels are clean. You know, you don't want them look inside there and you have all the dirty laundry inside your intestine. They want you clean so they can see the walls inside there. Because putting the tube inside your wall, they can't clean it out that way. You know, you got to be cleaned out first. And now, if you are experiencing symptoms of a metastatic colon cancer, and let me stop here. Cancer, once it starts to grow, it grows slowly in the case of colon cancer. There's some cancers that grow very fast. The case of colon can grow slowly. But if you haven't detected it in time, and you've been eating all the processed meat, you've been smoking, you've been not exercising, you're doing a whole set of things, that cancer finally reaches a stage that the cancer doesn't find enough space inside your intestines. That little nipple, that little bobby that was developing and developing into cancer, it has now grown to be the size of an egg or the size of a tangerine. But as it's growing inside your intestine, right, some of the cancer starts to grow out of the intestine wall, into the wall. It starts to reach a blood vessel. It starts to reach your lymph glands. And when it reaches your lymph glands, the cancer cells start to travel in the lymph glands. And the lymph glands would lead it to certain other parts of your body. If it goes into a blood vessel, guess what? It travels through the blood vessel to other organs of your body. Colon cancer loves to travel to your liver. It loves to travel to your liver. You understand? But the colon cancer could travel up to your lungs. It can travel up to your brain. It can travel up to all kinds of places, but it loves your liver. Liver. That's where it loves to go. One of the reasons why is that there's a special blood vessel that leaves the intestine and goes through the liver. So the liver is like, it's like, let me put it this way. If you are traveling through the Windward Highway, you want to travel from Kingston Windward Highway, and you find that you hear the road is blocked out there. Where do? You go up the VG Highway heading for Mespo. You understand? I want you to consider Mespo as being where the liver is. You understand? And so the cancer goes and travels up in that direction to the liver. And when it does that, boy, the liver becomes a perfect place for the cancer to grow. You know? Now, if the cancer was just found near that nipple or that bobby I was telling you about, or just where it has grown into the size of an egg or tangerine, they could actually cut out that egg and tangerine with surgery. But if it has started spreading and reaches up to your liver and your chest and your bone and your brain, is what we call it has metastasized. It has spread. Spread means it has metastasized. It has spread. It has traveled. And that's not good. That's not good. That's where colon cancer is often detected after it has spread, after it's gone up to the liver, after it's gone to the lungs. That's what we call an advanced cancer. Advanced cancer. If we detect it early, when it is just that nipple or that bobby, that polyp, and it's turned into a cancer, you know what we can do? And we can cut it out. We can pull it out. Sometimes they can put up a tube through your intestines from your back passage, and they could get it that way. They can remove the polyp. Other times they have to cut your belly, go in, and because they've done tests before, like x-rays and a CAT scan, they know exactly where to go and get it. They know the coordinates. They know the GPS of where to go to find that tumor inside your intestine. They can find it, whether it's over on the left, whether it's over on the right, whether it's over in the middle, whether it's down near your appendix, whether it's down near your rectum, you know, they can go and they can get it. The surgeons are that good. But if it has spread, the surgery, oh my, they could take out the egg and the tangerine and sew you back up. But it's already spread to the liver, the lungs, the brain. And so, as a result, other methods have to be used. Chemotherapy, radiation therapy, all sorts of different things have to be used. Some of which we have chemotherapy here in St. Vincent, but we don't have radiation, we don't have immunotherapy, we don't have all them sort of things. I understand that at the new hospital they're looking to start building this year, they are going to be introducing a number of those fine things. You understand? It's going to actually be the hospital that the acute care, we sometimes call it the acute referral hospital, but it's really an acute care hospital, is going to be one of the most advanced hospitals that would exist in the region. You know? Come on? Yeah? And I tell you, it's going to be thing. But let me say, we have to look out for certain things. Remember, if you see blood in your stool mixed in, or if the stool seems dark and black, and you ain't been eating no licorice, you ain't been eating nothing that looks funny. There's a fruit called black sapote. I had some in Mexico. It was the sweetest thing out. You know? Come on, I'll tell you something. Black sapote is absolutely wonderful. I should pull up my phone and show people the black sapote that I had. Oh gosh, they call it chocolate pudding fruit. They call it chocolate pudding fruit, black sapote. I really enjoy that. But what we do have, right, is seeing that dark stool is indicative that there's blood in the stool. Blood is usually red. But when blood's been sitting around for a long time, guess what? It starts turning brown and then it's turning black. So blood that's been bleeding from a tumor. Remember those? A tumor the size of an egg or the size of a tangerine inside your intestine is going to bleed. It's going to bleed. Little bits of blood is going to be bleeding all the time. You know, come on? And that blood, as it's traveling down, it's going to be denatured and it's going to turn black. It's going to turn your stool black. You become anemic too. Now, another thing we got to look for is if you are looking to pass your stool and your stool is coming out like a pencil. In other words, your stool ain't coming out like a banana or fig, that kind of size. You know, a small plantain or so. Your stool ain't coming out like that. It's coming out like a pencil, or it's coming out like a pen. It's coming out pencil size like this. You ever see? Imagine stool is coming out like that. Guess what it suggests? It suggests that there may be a tumor inside your rectum. That the tangerine-sized tumor or the orange-sized tumor is taking up space. So the amount of space for the stool to pass through isn't there. So it comes out in a pencil form. Kamal, you understand? As a doctor, we ask patients, what is your stool like? You understand? Have you been moving your bowels regularly? Have you had any change in your bowel movement? They have to answer that. Then we ask them, have your stool been coming more frequently or has it been slowed down? You have to answer that. Has your stool been diarrhea watery or has it been constipation or has it been normal? They tell you 1 week it's loose, another week it's constipation. 1 week is loose, 1 week constipation. Oh yeah? Then we say, what is the caliber of the stool? And they say, but it's coming out tin. I say, Yes, I've had a number of patients like that. If we ask them, have you noticed any change in the color of your stool? Is it brown? Is it green? Is it yellow? Is it red? Have you seen blood in the stool? I've seen it dark, like it's dark over the last couple of months. It's been black, eh? Okay. And what about in terms of, have you had any pain in your belly? Yeah, every time I move my bowels, I get a little cramp down there, you know? Have you been losing weight? I've been losing a bit of weight, I think, you know? And how about your strength? I've been feeling a little tired of late. We have to then write that person a prescription to go and get some tests done, blood tests. I want to see if they're anemic. We want to check this, we want to check that, right? We want to check your ultrasound. We want to maybe go and get other tests, but we may send them to Georgetown to do a colonoscopy, to look up their back passage with a telescope. We look at the back. Now, when I talk about telescope, I'm talking about a scope about thinner than this tube. And what they do, they numb the area, your anus. They make sure everything is all right. And they were to insert this very slowly and push it up and so forth. And the doctor is looking at a microscope at the other end, or sometimes a television screen they have, and they're able to see the lining of your intestines going all along until they come up, and hopefully they won't see anything that looks like a polyp, a tumor the size of a nipple, a tumor the size of an egg, tumor the size of a tangerine, or worse, a big tumor like the size of an avocado. You understand? You don't want that. You don't want them kind of things. So I've been talking today about colon cancer and, prevention, lifestyle changes to prevent colorectal cancer, eating healthy diet, rich in fruits and vegetables, like in St. Vincent. Eat a palo eat a horsey mango, eating lettuce, kale, all that kind of thing. Not smoking, not a lot of alcohol, no strong rum. Yes, strong rum is notorious now in terms of as a risk factor for colon cancer. Keeping an active lifestyle. People who suspect that they have any form of cancer, especially colorectal cancer, see a doctor today. You understand? Don't wait to butt up on Gerald Thompson in the street and say, hey, I want to ask you something. Go and see somebody else. Treatments are more likely to be to lead to cure if they're picked up in the early stages, right? And as I said, we can now do colonoscopy. We can now do CAT scans. We can now do MRIs, right? Come on, did you know there's an MRI in St. Vincent and the Grenadines? Do you know there's an MRI in St. Vincent and the Grenadines? Listener, do you know there's an MRI in your country where you're listening from? Check and see that. The treatment of colorectal cancer are based on the type of cancer, the stage we've picked it up at. If it's a polyp, a nipple-sized polyp, an egg shape, and a tangerine or avocado size, And the treatments include surgery, radiotherapy, chemotherapy, immunotherapy, and we don't have available here. Now, surgery is often used in the early stages of the cancer to remove the tumor, right? And then we have to look at the other options. And so in early stage of diseases, the primary treatment for early stage of the tumor is to remove it if there is no spread to any of the lymph glands. Remove it, right? And often with a colon, we sometimes can do it by many ways, by pushing the same tube up the back of your anus into your intestine, and we could remove the tumor through that means, believe it or not, right? If it's late stage cancer, more advanced stages, then chemotherapy is often used as the first line of treatment. Chemotherapy, once they're spread, this is to shrink the tumor. I still do surgery, but you don't want to do surgery first. For early stages, surgery first. And we watch it, and we may need to do chemotherapy after. But when it's an advanced stage, we do chemotherapy first. Hopefully that's going to shrink the tumor before you could do anything maybe about removing it. So all sorts of different treatment measures and so. But the important thing is that colon cancer is rare. It is very aggressive in terms of it can cause death. It's the second leading cause of cancer death. You know, colon cancer only accounts for 10% of cancers for humans, but it's the second leading cause of cancer death because it's often picked up too late. We haven't had any calls. You know, I know it's a little bit of a depressing subject. I haven't had any text messages, but I want to really get this message out early in 2024. We need to change our lifestyles. And that lifestyle change is not just what you're putting into your mouth, what you're shoveling into your mouth, the type of food you're putting in. It's not just that alone. It is also the preventive measures in order to detect a cancer early. There are tests, as I said, where we take your stool and it can check it for colon cancer. That's not available readily here in St. Vincent Grenadines, but always in America, England, Canada, it's available to you. What we can do here is check your stool for blood, and that can be a factor. But the best method is out in Georgetown. They can do a colonoscopy and check to see if they see any physical stool there. So let me make this clear. In certain other places, to avoid having to get a colonoscopy, they could take a sample of stool, put it in a little packet, and put that packet into an envelope, and they could send it off to somewhere. And they would check it for you and send you back the results and show it's positive or negative. Go to your doctor and check it out. For St. Vincent, we don't have that. Instead, you can have your doctor refer you to, and that's if you have symptoms or if you have a family history, to Georgetown, Modern Medical, where screening can be done by a tube, a little smaller than this, being put up your back passage. Let me tell you, but when they put it back, they put all kind of KY jelly on that, so it's real slippery, right? And Kamal's face, what happened? You're looking at it. The way I'm describing it does probably is not encouraging. It's probably not encouraging. And people will say, Doc, you just turned you had me all night, but now you turn me off, right? I ain't going for that. But boy, I tell you something. I'm getting one very soon myself. I need to check myself out, right? And make sure. And if I'm going to check myself out, I'm a doctor, right? I can't put up, but I've been trained in how to do colonoscopies, but I can't do a colonoscopy on myself. You said I can't do a colonoscopy on myself. So therefore, I'm going to have somebody else do it, another doctor do it, right? And I want to see the results because a stitch in time saves 9. Stitch in time saves 9. I want no egg size, tangerine size, avocado size tumor growing inside my belly, my intestines, because it's horrible. Second most common cause of cancer deaths. I don't want that. Stitching time can save 9. I want to go and pick it up and detect it. Ladies and gentlemen, we've been chatting. I want to bid you a very good evening and good night. Follow through, check out, and prevent colon cancer.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingston.